Products are shown for demonstration purposes only. The American Heart Association does not endorse or recommend any specific manufacturer or products. If you see an infant or child suddenly collapse, it is important to act fast. Helping to save a life is easier than you might think. Child CPR is similar to adult CPR, but it is especially important to give breaths to a child who needs CPR. A child in cardiac arrest who is unresponsive and not breathing normally will not survive without CPR. Your actions can help increase their chances of surviving. If you're alone, CPR on infants and children should always include breaths done in cycles of 30 compressions followed by 2 breaths. First, check to make sure the scene is safe. If you're near anything that can hurt you or the child, move to a safe place. Next, tap the child's shoulders and shout, "Are you okay?" If the child is unresponsive, shout for help. Point to someone and ask them to call 911 and get an AED. Or call 911 yourself and put your phone on speaker mode so the operator can help you. Now, check for breathing. Scan the chest for 5 to 10 seconds, looking for it to rise and fall. If the child is not breathing normally, immediately start CPR. With the child flat on their back, kneel beside them and lean directly over their chest. Place the heel of one hand or 2 hands, one on top of the other, in the center of the chest. Then, push hard and fast in the center of the chest, giving 30 compression. It's important to keep a steady beat of 100 to 120 compressions per minute, which is about the same tempo as the song Baby Shark or the rate of the music that you're hearing right now. Push down about 2 inches, about the height of a credit card, letting the chest return to its normal position between compressions. Now, after 30 compressions, you'll give 2 breaths, one after the other, that makes the chest rise. Put one hand on the forehead and the fingers of your other hand under the chin. Tilt the head back slightly and lift the chin to open the airway. Pinch the nose, take a normal breath, and cover the mouth with your mouth, giving 1 breath for 1 second while watching for chest rise. Give another breath. Don't stop compressions for more than 10 seconds to give breaths. Continue giving cycles of 30 compressions and 2 breaths until help arrives. Hopefully, you never have to perform CPR on a child. When possible, use an AED, automated external defibrillator, in your life-saving efforts. When the AED arrives, use it immediately. Once the AED has arrived, place the child face up on a firm, flat surface and follow the prompts of the AED. Try not to interrupt compressions for more than 10 seconds. Turn the AED on and follow the prompts, which will tell you everything you need to do. You must remove clothes and anything else that covers the chest, as AED pads must be placed directly on bare skin. If necessary, wipe the chest dry. Place pads on the chest. Use the smaller child pads if they are available. If child pads are not available, use the larger adult pads. Peel away the backing from the pads. Follow the pictures on the pads, attach them to the child's bare chest, ensure there is nothing between the pad and the child's bare skin. Plug the pads connected into the AED if necessary. Follow the prompts and let the AED analyze the heart's rhythm. Make sure no one is touching the child and loudly state, "Clear." The AED will analyze the heart rhythm. If the AED says that a shock is not needed, resume CPR. If the AED advises a shock is needed, make sure no one is touching the child and loudly state, "Clear." Push the shock button to deliver the shock and immediately resume CPR with 30 chest compressions and 2 breaths. Most AEDs will prompt you to analyze the rhythm again after about 2 minutes of CPR. Keep doing cycles of 30 compressions and 2 breaths and continue following the AED prompts until the child begins to respond or help arrives. Hopefully, you will never have to use CPR on a child, but know that CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. Again, if you see a child suddenly collapse, don't be afraid to start CPR. Your actions can help save a life. To learn more, visit heart.org/nation.